Hello, my name is Bria, and with my team members Sophia, Connor, and Myra, we will be discussing what measures are used to determine therapeutic outcomes. We will highlight the various ways and approaches that are commonly used to measure therapeutic success, why it is important to know when to test for success, why testing at specific times is important to measuring success, and the importance of the therapeutic alliance between therapists and clients, specifically when it comes to ending treatment. Ultimately, we hope to show ways to measure therapeutic success in the absence of concrete measures available in other sciences. With that in mind, I'm going to hand it off to Sophia to start our discussion.
So before we begin, we would obviously want to talk about the common assessments of therapeutic success. This can commonly be seen in self-report of the patient or expert opinion. In this case would be the therapist. And with self-report, it's normally in the form of a questionnaire being how strongly they disagree or how strongly they do agree with the various symptoms that they're experiencing. And a therapist's expert opinion with the patient in conjunction can come to the best conclusion on whether or not the therapy is being successful, because we can have both opinions weighing in on the patient's symptoms. And it can be with self-report as what they're reporting they're feeling because they know their emotions better and what they're experiencing more. And then with the expert educational opinion of the therapist to help and kind of come to an accurate conclusion to the progress of the patient. And then I'm going to go pass it on to Connor to discuss the kind of problems that we can face when just basing it off self-report or just basing it off the expert opinion.
So the journal article I looked at aimed to assess the best time for measurements of success within the therapeutic process. The instruments used to measure success were a clinical and socio-demographic questionnaire, a symptom checklist, an outcome questionnaire, and a working alliance inventory. These measurements relied on self-reports from the patient or from both the patient and the expert. The study followed the first 6 months of psychotherapy of 304 patients. The therapeutic alliance was evaluated after 4 sessions. Symptoms, interpersonal relationships, and social role were evaluated at intake, and again at 12 sessions, and finally at 24 sessions. Results indicated that the therapeutic alliance was sufficiently measured after 4 sessions, but more time was needed to measure other aspects like tasks and goals. After 12 sessions of psychodynamic therapy, the patient improved on all dimensions except if they had phobic anxiety. The study concluded that during the intermediate phase of the psychotherapy process, around 12 sessions is a good time for the first major assessment. The study also concluded that the effectiveness of PDT depends on a combination of the number of sessions, the presence of a therapeutic bond, and a proper definition of treatment goals and interventions. The authors suggest that the first stage of PDT should comprise of the first 12 sessions over 3 months, focusing on crisis symptoms and the development of the therapeutic alliance. At the intermediate phase, after 12 sessions, all dimensions of the therapeutic alliance, especially the treatment, should be reassessed. Knowing when to test for progress is as important as knowing how to test. By testing after the 12th session, a patient will likely have noticeable improvements that should affect further treatment options. The main takeaway from this article regarding the measurable success of the therapeutic process is that breaking up the process into early, intermediate, and advanced stages of therapy allow the expert to test at crucial periods and allow the patient to see structured growth that could influence their desire to continue therapy. So next we'll have Myra.
So my article was about the new approach, looking at the psychosocial functioning as a necessary outcome criterion for therapeutic success in schizophrenia. So although in the past most attention was paid to psychopathology, these days outcome parameters such as cognitive and occupational performance, emotional stability, quality of life, and psychosocial functioning are being recognized as important determinants of treatment success. Instead of only reducing symptoms, therapy with antipsychotics must attain higher goals, such as remission and recovery today. Through the recent findings through the psychosocial performance scale offers a validated, reliable, and operational tool to assess the psychosocial functioning of patients during the course of treatment as well as in the acute state. The mini ICFP might be a similar instrument for measuring psychosocial functioning. To summarize, in the future, medication and non-medication treatment strategies will also be judged by the ability to improve the psychosocial functioning of patients with schizophrenia, as measured by the Personal Social Performance Scale and the Mini ICFP. I will now hand it off to Bria to talk about who decides the success.
Yes, so we have talked about how is success measured, when should it be measured, and what are certain different treatment types that can be commonly used to lead to success. But I want to talk about who ultimately determines if therapy is successful or not. In order to do this, I wanted to take a step back and look more into the therapeutic alliance between clinicians and their patients. So, therapeutic alliance is often defined as the collaborative relationship between patients and therapists in the common fight to overcome the patient's suffering and self-destructive behavior. Now, there are 6 common scales that are used to measure therapeutic alliance, but the article that I looked at focused just on 2 specifically. It focused on the WAI client and the WAI therapist scales. It showed, using those measures, that over the course of 3 months, 15 months, and 33 months of treatments, consistently, the stronger the therapeutic relationship, the more successful therapeutic outcomes were deemed to be. Now, this was really interesting when you paired it with noticing that there are ups and downs in the therapeutic alliance. So there are dips at times where therapists and clients are not as in sync, and that often was followed by even more successful outcomes when you come up on that upswing, and the relationship is reestablished and stronger, and the patient's success in their therapy is also stronger. In fact, this strength in relationship was shown to be more correlated with successful outcomes than any other type of specific treatment that has been used in common psychotherapies currently. And so when this comes to who determines the ultimate success of therapy, we think that we need to really consider the collaborative relationship between therapists and clients and how they need to together come to that decision when they're at a time of healthy and strong alliance.
So after hearing all the points of my peers and their research regarding the success of therapeutic outcomes, we can come to a conclusion to say that determining success is greatly based on the relationship between the patient and the clinician. Without that relationship and without that collaborative effort, no one can really determine how successful something may be within their therapy. And I just want to point out that if therapy was to provide zero or no relief of any psychological symptoms, why would someone continue to seek out help for their mental health issues? So it's very important in determining the success within therapeutic situations.
And one way that the research can directly affect clinical care is the way that self-reporting and expert opinions have their own advantages and drawbacks. With self-reporting, one may have implicit biases to be socially desirable, and on the other hand, experts will understand what the patient is feeling as well as the patient. It's also important to test when the change is occurring and not before or after, so that the patient receives the correct care for the stage of therapy that they are in. The therapeutic alliance was also found to be a necessary aspect of measuring success. With a strong therapeutic bond, the patient is more likely to see success faster and relay that information with less bias on self-report inventories and scales. Next, Myra will offer some future questions.
Although much is being learned, there are still some future questions to be looked into. For example, our future question for a future study is asking how we can measure the physiological effects of therapeutic outcomes. Also, any approach to measuring therapy progress, effectiveness, and outcomes is not likely to be appropriate for all people in all situations. So we could look further at how being from different multicultural backgrounds have different experiences to therapeutic success. This concludes our group's presentation on standard measures used to determine therapeutic outcomes and successes based on our research.